This is Wonka. Wonka has had his third and fourth weeks of chemotherapy, and this is his treatment diary. He is still very early days, but generally having more ups than downs. He has lymphoblastic lymphoma of his stomach, and oddly enough, whenever he has a dose of chemo, he seems to stop vomiting completely for several days. He had unfortunately lost 150 grams by his third appointment and was becoming increasingly fussy with his food, but still seems to be in good spirits. His blood work is still normal. He's currently on a modified Wisconsin-Madison protocol, also known as CHOP. CHOP is a series of different chemotherapy agents which are rotated through on different weeks. The C stands for Cyclophosphamide. The H stands for Doxorubicin. Really, it's hydroxydanorubicin, which is what it used to be called. The O stands for Vincristine, because it used to be called Oncovin. And the P is for Prednisolone, which thankfully makes sense. Wonka didn't actually start Prednisolone until 5 days after his Doxorubicin, just because he hadn't needed it before then. In cats, we start with Vincristine on week 1, then Cyclophosphamide on week 2, Vincristine again on week 3, Doxorubicin on week 4, and then we have a week break. We do that twice, and then we spread the treatments out to fortnightly. All of these medications work a little bit differently and all have slightly different side effects, but so far he's handled them pretty well. Vincristine is the first one, and he's had 2 doses so far. Vincristine works by preventing cells from dividing, but it works on any and all cell types. Because the cancer cells are dividing much more frequently than normal cells, they will be affected more often. Another group of rapidly dividing cells in the body are those that line the gut, so diarrhea and constipation are commonly reported, but Wonka hasn't shown any of these so far. Ataxia, the wobbly gait, is also reported in cats, but Wonka's isn't actually any different than normal. His normal, anyway. Before treatment, he was vomiting up to 7 times a day with his stomach cancer. After the first dose, he didn't vomit at all for 4 days, and after the second, he was vomit-free for 5 days. Cyclophosphamide was his second chemo agent, a tablet I gave at home for a cheap week. It makes DNA stick to itself so it can't be unzipped to replicate or make proteins, and again will target the most rapidly dividing cells. It also has a reputation for causing bloody urine in cats, so that week I encouraged Wonka to eat a lot more water. He's not particularly efficient at drinking, so it's much easier to make him eat the water than just drink it. After cyclophosphamide, he didn't vomit for 10 days. He was off his food for about 6 hours a few days after the tablet, but overall tolerated really well. Prednisolone just suppresses all your immune cells in general, and as lymphoma is a cancer of the immune system, that's useful, but it has a long list of side effects, including increased thirst, changes to the liver, and muscle loss. Wonka started Pred 5 days after Doxorubicin, as it is now increasingly difficult to coax him to eat, and Prednisolone has the pretty helpful side effect of encouraging appetite. The Doxorubicin is interesting. That drug has quite a reputation as the so-called Red Devil, and it is a potent weapon in the arsenal against lymphoma. It prevents DNA molecules from being rewound in replication, so again will affect the more rapidly dividing cells in the body. The cancer is the target, but common collateral damage includes cells in the gut, hair follicles, bone marrow, and mouth. It's also reported to have toxic effects on the heart in dogs and humans, but fortunately not in cats. For those reasons and its potency, Doxorubicin earned the nickname the Red Devil, but it is very effective for patients that can tolerate it. Kind of scary though, as it's corrosive enough to dissolve through cotton if it's spilled and causes massive tissue damage if any is spilled outside a vein, so should be treated with due respect. The Doxorubicin has definitely been the hardest for Wonka to cope with so far, though at this stage I don't know what side effects from the chemo and what symptoms of his lymphoma. But as of Saturday just gone, so that's the 24th, he was down to 4.2 kilos. So that's a 250 gram loss in a week, and he's very difficult to coax into eating. So he's now on prednisolone and meropitant tablets, and he seems to be interested in kitten food for now, but overall he does look a little worse than he did a fortnight ago. Most of that since the Doxorubicin. But now he's got a whole week off chemo to recover before going back to Vincristine, which he handled well. So my job at this stage is to just feed him up as much as I can.